I didn't know what was going on. For 8 years, Michael was so healthy. None of this made any sense. It just came out of nowhere.
That's not something we had thought could happen that fast. You just don't realize how quickly things can go from, it seems like a flu, or you just got a fever too. We need to put tubes in your child. It happens like in a blink of an eye.
And they give Michael a 5% chance of survival.
Sepsis is the body's overwhelming response to infection, which can lead to tissue damage, organ failure, and death. Sepsis is the leading cause of death in children worldwide. About 3 million children die every year from sepsis. And in the US, more than 40,000 cases of children suffer from sepsis every year. Approximately 10% of those die, so there are over 4,000 deaths every year. To about 12 children per day, 1 every 2 hours, and this is more common cause of death than the traditional killers we think about, such as cancer.
Sepsis is the killer that's hiding in plain sight.
Michael was extremely curious, active, and happy.
I guess he was, like every 7 or 8 year old kid, just run around trying to play with his friends and have a good time.
Michael was so athletic and into so many sports that he tended to have scratches all over his body. I mean, we wouldn't even think twice. And so did his brothers from playing sports. Saturday night, he started not feeling well. He had a high fever, was lethargic, really lethargic. We came home Monday, and Michael still wasn't feeling well, and we took him right away to the pediatrician's office. And the pediatrician said it looked like the flu or a viral infection, and they gave him medication and told me in 72 hours, Michael would start feeling better. So we brought Michael home. I just felt he would start to feel a little bit better. Even if he wasn't great, you would see some improvement in 48 hours. And we didn't see any. If anything, he seemed more lethargic, more weak. Something wasn't right.
My wife decided that we can't wait 72 hours.
Most families, parents, caregivers, they know their children very well. So if their child is not acting normal, that is one of the first signs. It is very nuanced because it may mimic many other conditions. It may start in very subtle ways, but especially in younger children, they can deteriorate very quickly.
When we brought him to the pediatrician's office for the second visit, there seemed to be more urgency. And he listened to Michael's heart, and then he also asked me about this scratch that Michael had had. That's when he suggested, I think we should get Michael to the hospital. They were really monitoring all his vitals while we were in the ambulance. By the time we got to the emergency room, there were over 20 medical staff waiting for Michael to arrive. They brought Michael into one of the rooms, and they had all these physicians working on him at the same time. And they asked me some questions like, has he gone to the bathroom recently? Did he go last night? They took some blood work. They took a swab of the wound that was underneath the abdomen. The lab needed the culture to grow so they could really see what was causing the bacterial infection. They brought Michael upstairs to the ICU. Within 30 minutes, all his organs were shutting down. I mean, Michael was on dialysis. His heart was failing. His liver function was poor. And Michael says to me, "Mom, I can't breathe. I can't breathe." And so I yelled, "Help!" And all the nurses came in, and they quickly, whisked me away, and they put Michael on all these machines all at once, and I thought I was going to lose him.
It's very common when a child is this severe and going into septic shock, we may have given drugs to sedate or put him into a coma to really preserve the flow of his blood to the vital organs.
I'd say within 45 minutes, Michael was in a medically induced coma.
The hospital had very good infectious disease doctors, and they had said that it was sepsis.
Nearly half of Americans have never heard the word sepsis. Sepsis is the body's overwhelming and potentially life-threatening response to an infection. Here are the symptoms of sepsis in children that parents and caregivers should look for. When your child is abnormally cold to the touch, may have skin that's mottled, bluish, or very pale, a rash that does not fade when touched, very rapid breathing, a convulsion or seizure, very lethargic or difficult to wake up, a child who is not eating, frequent vomiting, or no urination in the past 12 hours. If you see one or more of these symptoms, go to the emergency department or call 911 and say, "I'm concerned about sepsis." With infants, it's important to be even more vigilant because they're not able to communicate how they're feeling, and they're likely to deteriorate more rapidly than older kids or adults.
With the dramatic signs and symptoms, it is very important for parents and caregivers to call 911 immediately, rather than trying to locate the pediatrician.
If sepsis was treated as a medical emergency, many more patients could be saved. Upwards of 200,000 patients per year here in the US.
Michael comes in with what seems to be an innocuous thing, turns to sepsis very quickly. This led to the diagnosis of immune deficiency. Some of the more common chronic diseases that would make a child more susceptible to sepsis are the immune deficiencies, cancer, diabetes, chronic chest infections, and sometimes asthma, and chronic skin conditions. There are a variety of common infections that can lead to sepsis, depending on the condition of the child. We are all interested in giving the right antibiotic at the right time. We are also very much worried about antimicrobial resistance, where by giving antibiotics indiscriminately, we can cause resistant organisms. But where a patient is showing the signs and symptoms of sepsis, antibiotics need to be given immediately.
Sepsis mortality rises every hour that goes by without antibiotic therapy.
There are certain tests that may help us to point in the direction of sepsis, but they are not absolute. The ability to recognize the signs and symptoms and do an appropriate physical examination, those are more important than any laboratory tests. Treatment is time sensitive, and you cannot wait on these tests. By the time the results come back, an opportunity to provide treatment very early and maybe prevent death and disability would be lost.
Those most vulnerable to sepsis are the very young, the very old, and those with chronic conditions.
And the doctor took us aside to another room, and he just told us things were rapidly getting worse. And they didn't know if Michael was going to pull through.
They told us to bring in Michael's brothers. That might be the last time that they saw him.
The doctor was by his side with 3 nurses, non-stop, for 48 hours.
They had him on a whole cocktail of vasopressors, and just to keep his blood pressure up.
Vasopressors are given to combat life-threatening low blood pressure. They may divert blood from the limbs in order to keep the brain and organs alive, and this sometimes results in the death of extremities.
There was discoloration in his arms and his legs, and it was blackish purple, almost like horrible bruising, but it got darker as you got further away from your torso.
I mean, I'd say it was like a long 2 weeks. He was still in the medically induced coma, and I remember cheering for him in that hospital room, the way I would cheer for him on the sidelines. And I'd always say to him, all I want is all you got. So I would start cheering really loudly, and then all of his numbers on the monitor went up. And I remember the nurses afterwards saying to me, you know, you really can't stimulate the patient. But he heard me. He heard me. Then they slowly weaned him off the medically induced coma. I was in the room when I could see Michael's eyes flutter.
I woke up, I looked over to my mom who's on my right. I remember seeing like a face of relief.
I said, it's Mom, and you know, you're gonna be okay.
And I didn't really know like what was wrong with me. I just remember like seeing them, just saying hi, like, I'm okay, I'm alive. By this time I had realized my hands and feet were black, like that's not normal. So they told me they might have to amputate them eventually, but first they were gonna try to help me get better. And I always kind of just assumed they were gonna heal because that's what my 8-year-old self thought, doctors heal people.
After 3 months, they sent us home, and slowly you could see the hands breaking away at the wrist point. You could see like the bone starting to break. Yeah. As a parent, to know that your kid's losing all four is just unbearable.
I was scared, but at the same time, I remember being relieved because I had been a really active kid when I was 7 years old, but for the past 2-3 months, I'd been just sitting down and doing nothing. And I was told after I got the amputations, I could start doing things again.
Every year in the United States, about 500 children, limbs are amputated because of sepsis.
And we had to wait until the wounds healed before he could be fitted for prosthetics.
I remember being told I was supposed to go to a prosthetist to start rehab to get my prosthetic legs. And at the time I was excited because I just heard I was gonna get feet, I was gonna be able to walk, but people kept telling me it was gonna be hard, and I kind of didn't believe them. I was like, how hard is walking just one foot in front of the other?
40% of cases of sepsis in children who survive will result in some disability. And the disabilities occur in very many forms, even from subtle learning disabilities in children to brain damage, to kidney damage, to organ failure. It can lead to physical disabilities of amputations, okay? It can lead to depression, anxiety, and long-term consequences.
I was in rehab for at least a couple months until the point where I actually wanted to go back on the football field and back on the lacrosse field, and I actually started playing sports right after I was able to run, so that was exciting. It was cool that I taught myself how to play lacrosse again because there's no one out there really who has amputations and tries to play lacrosse, so just kind of picked up the stick, put it in my elbows, did a lot of different things, and I slowly got better and better and kept practicing. It was nice to be back in the field with my friends. They were all happy to see me. I think it's important that I tell my story because if I had gotten in the hospital quicker, maybe I could have been saved and also kept my hands and feet.
If we had waited any longer, Michael wouldn't be here today. So if you see the symptoms, just keep pushing. Push to get into the doctor, go to the ER, whatever you have to do.
Michael's incredible. Michael's spirit is just immeasurable. And to this day, he's just so optimistic, so positive, and so happy. And Michael's so happy he's alive. That's the greatest part. He doesn't see himself as different from anyone else. And he doesn't want to be treated any differently. And he's so confident in his own skin.
If more people know my story and know the symptoms of sepsis, they can get to the hospital and find help quicker to save their lives, potentially.
He's just super special, and we get our strength from him every single day.